POTS, let's define it, right? It's postural orthostatic tachycardia syndrome. Essentially, Ratatouille, hey, welcome. So we're going to be doing a webinar on POTS next Wednesday. And we're going to be talking about a lot that you probably haven't heard before. We're going to be talking about kind of, current research. We're going to be talking about really what's going on as far as medical trials. We're going to be talking about mechanisms behind POTS because it's a syndrome, right? Remember, again, it's important to understand, right, that POTS is a syndrome. So I have the S underlined. Okay. And so meaning that there are different mechanisms and reasons. In fact, there's 3 different kinds of POTS: volemic, neurogenic, and hyperadrenergic. So what we're going to cover in that webinar is the 3 different kinds. And we're going to talk about really, again, something called dysautonomia. And so dysautonomia covers all 3 of these different versions of POTS. And of course, POTS is diagnosed through what's called a tilt table test. And it depends on if you're a teenager versus if you're an adult, meaning, again, their diagnostic criteria is slightly different. But essentially, this is going to boil down to, do you spike your heart rate in relation to positional changes? Okay, so again, what's really important here to understand is that 68%, 68, okay, of patients with a positive tilt table test will get a psychiatric diagnosis prior to the POTS diagnosis. Okay? So again, right, the reason why this is important, okay, the reason why this is important is because most patients with POTS are going to struggle for years before they have somebody figure it out, right? So the first hurdle is just getting to, right, where you have the opportunity to do a test. Now, remember, right, what happens as far as soon as you get a diagnosis, right, it is salt, okay? It is water. It is BB, beta blockers, right? So beta blocker, right? And then it is compression. So some form of a stocking, okay? Because obviously, again, part of what's happening, right, is that there is, right, a blood vessel. And because of different mechanisms, there's something that happens, right? And there's a process where you go from one size of blood vessel to, right, a larger diameter. So again, remember, blood pressure is utilized to make sure that we're pushing blood volume, and that blood volume is going back up so you don't pass out when you stand up. Okay. Is it important and is it useful to know what type of POTS you have? Yes, there's some value and some utility there. But I'm going to talk to you a little bit more about, again, the mechanism behind POTS here in a second anyways. Okay. Linda, no, tilt table tests are not always right because most of POTS is inflammatory. So because most of POTS is inflammatory, right? This is what happens. This is, and guys, if anyone has POTS in the chat, let me know if I'm right or if I'm wrong, okay? Just for what I'm about to say, okay? Most of the time what's gonna happen, right, with patients is they see an ebb and flow of their symptoms. They'll go having a terrible week, terrible, and then, kind of got better for a couple days, and then, holy crap, I got worse. And then, oh yeah, it's kind of better. Oh, it must be the beta blockers are working. And then, oh, here we go again. Woo! So it feels like a roller coaster. Yes. Good, bad, good, bad. Okay? Here's the deal. It's inflammatory. Yeah, Lily. Stress is a major driver. So Lily, we're going to talk about cortisol, all right, during this webinar. So if you guys are, again, you want to know, right, like I've been seeing dysautonomia cases for 18 years, right? We just saw a major spike in 2020. What happened in 2020? A major trigger for inflammation. Again, this up, down, right, is characteristic of POTS because it's inflammation that is literally, right, inflammation. Look at how high tech this gets. Look, arrows. Inflammation is driving the up, down, right? But it's more than just inflammation. It is immune, right? It's immune activation, which then drives chronic inflammation, but it cycles up and down, up and down. Alexis, exactly, right? So again, what's going to happen is that, right? Yeah, you're going to see autoimmune being significantly connected. Okay? So here's the deal, right? You have a diagnosis that if you get it, right? Like I was just saying, 68% of patients with a positive tilt table test prior to their POTS diagnosis will get a psychiatric diagnosis. What diagnosis? Anxiety. It's anxiety is what people get diagnosed with. Why? Unless you've experienced a POTS, right, related episode, you don't really know, because it's like it's pretty wild. Because as soon as your heart rate spikes, right? Remember, blood pressure is low, blood pooling is occurring. You can't get pressure and volume of blood to your central nervous system, so your heart rate has to compensate. It has to spike up. But you can't just, Abby, I'm sorry that you're in a flare-up right now. Okay, Abby, come to this webinar next Wednesday. We're going to change your life. Okay. So again, right? What's crazy is you'll see a lot of athletes. I don't know if there's any athletes out there in the chat right now, and you're going to see young, fit, young, athletic patients who are dealing with dysautonomia. It's very common for what I've seen. Okay. So understand, right, that the treatment right now, Sola, there you go. Chris, martial artist, right? The mechanism, right? So again, their treatment is going to be salt, water, beta blockers, and compression. Now, this one is the biggest concern that I have. I'll put 2 stars here. I have a bit of a concern about this one too. But beta blockers, right, essentially reduce the intensity of what your heart's going to be able to do. So a lot of people feel worse on beta blockers. Beta blockers also can cause fatigue. So a lot of people feel more fatigued when they take it. They'll say, hey, the intensity of my POTS flares are better, but I'm actually suffering from more fatigue now. Okay? So that's something we have to kind of, unfortunately, you guys have to deal with, because that's all that's available right now as far as for medicine. But here's what you have to understand, okay? So here's really, really important, right? Again, really important. And we'll talk more about this on Wednesday. So again, Grace, the atenolol gang, the propranolol, yes. So again, right, we're going to talk extensively about the root causes on Wednesday at the webinar, 5 o'clock Mountain Standard Time. The guys, I'll stream this on TikTok. The difference is that if you sign up for the webinar, you'll get reminders, right? But then secondly, we're going to send you the recording of the webinar. Okay. Amy, yes, mold will drive autoimmune activity. Sarah, nothing like being gaslit, huh? Libby, hey, great question. So, you're going to get a lot of unpredictability in the symptoms that people show up with. Now, sometimes it's going to be more menstrual related, right? There'll be a menstrual aspect to this. You're going to see it days after intense exercise, but positionally is probably the biggest clue that you can do. Now, remember, sometimes it's not immediately after a position change, but it very commonly is connected to, hey, overnight, I had an anxiety, I had a panic attack in the middle of the night in my sleep. Like, that's an unusual characteristic finding for a generalized anxiety disorder, right? When you move at nighttime and you trigger a POTS flare, guys, that's not a mental health diagnosis anymore. That is, right? That is an immune system and an inflammatory diagnosis at that point. So again, the positional changes, right? Feeling absolutely terrible, because a lot of times what will happen is you'll kick up inflammation before you have that POTS flare. And so again, as you positionally change, you'll start to see a constellation of more than just anxiety, but anxiety is a big one. Yeah. Okay, SEP. So again, SEP, let's talk about that, okay? So here's important, right? So here's what's gonna happen, right? You have salt, water, beta blockers, and compression. That's all. That is it. But here's again what you have to understand, right? So if you wanna talk about this from a mechanistic perspective, okay, 2019, Journal of the American Heart Association, okay, published a paper stating, right, so there's a paper that was published, peer-reviewed journal, okay, 89%, okay, of patients with a positive tilt table test, okay, 89% of patients with positive tilt table test, okay, had, again, G protein autoantibodies. Okay. So what we're talking about, right, is that in essentially 9 out of 10 patients, okay, there is a very significant, right, autoimmune, okay, and inflammatory connection. Okay, so that alone right there, for me, right, that was published in 2019. And then it became obvious, right, as soon as we went through COVID era, because you would see people get long haul chronic fatigue and again, dysautonomia very consistently after they got an infection. Now, people that get, not everyone that gets COVID and not everyone that got the vaccine, right, got dysautonomia. But remember, right, autoimmunity is genetic predisposition, it's environment, and it's triggers. So effectively, right, you get a priming through genetic predisposition. There's usually environmental factors that you've been exposed through your life. Could be heavy metals, could be mold, right? Could be phthalates, parabens, chemicals, could have been estrogen mimicking, right? Compounds that you're exposing yourself to. So you put enough of those things together, round of antibiotics, right? Had your tonsils out. You were, again, C-section, you weren't breastfed. There's enough of these historical issues, right, that start to push you in a direction. And then typically at a certain point, right, you have a high enough level of inflammation that you start to induce an autoimmune response. Sue Banks, POTS is called postural orthostatic tachycardia syndrome. Okay, so it's a constellation of different mechanisms that lead to the inability to regulate heart rate because of the inability to regulate blood pressure. So it shows up because, again, for a lot of people, and not all circumstances, but a lot, they'll be in a, again, let's say call it a seated position. You could be laying down, but you get up and you go, and you get lightheaded. Now, it's not just being lightheaded, it's lightheaded followed, right, by additional symptoms. It's part of the syndrome. So what happens is people, again, will do what's called a tilt table test. You put your head over a table and they go, right? And they tilt you, trying to recreate and provoke the response. So if you're further enough along the diagnosis, you a lot of times can recreate that. Okay? But again, remember, yeah, Sarah, if they put you in a hot room, that stress probably would have caused a positive tilt table test. So again, right, yes, you can have low resting heart rate with POTS. Absolutely. Especially if you're a conditioned athlete. Okay? So again, what happens and what people don't understand, okay, is that there are mechanisms behind this. Now, I'm going to talk about 4 major mechanisms on next Wednesday, right? So meaning, I got a webinar next Wednesday. We're going to do it at 5 o'clock Mountain Standard Time, okay? You guys, in my bio and in my link tree, you guys can register for that, okay? So what's going to happen here, and what I want to mention right now is the most common mechanism. Alexis, yes. So let's talk about that. One of the major mechanisms, we're going to talk about 4 root causes on Wednesday. But one of the things, right, and I would argue probably the most common is going to be directly connected to your ferritin. Okay? So ferritin, right, anything that is, again, causing a suboptimal ferritin. Because your ferritin status is actually, again, directly impacting your ability to oxygenate. Therefore, right, also it's going to change blood pressure and heart rate as a result of that. Can Hashimoto's be triggered by perimenopause? It sure can, and we see it on a regular basis. Absolutely. Anything that causes estrogen deficiency or estrogen excess, or especially the spiking of hormones, is going to drive Hashimoto's. Sarah, so this is when I ask people, what's your ferritin number? That's one of the labs that you absolutely have to have, right? If you are concerned that you have POTS, or if you have a confirmed, right? If you have a tilt table test, and you probably have an anxiety diagnosis, but one of the things that I absolutely would need to know, right, is what is your ferritin doing? Sola, I'm not asking you if your labs are normal. I'm asking you what your ferritin number is. Sola, this is where we have to be careful. Okay? Again, ferritin, the lab reference range, is for a female is abnormal when it's under a 16. All right? So again, this is where it gets crazy, right? Because if you look at ferritin, okay, the American Gastroenterology Association says that your ferritin should be above a 45, okay? Dermatologists, when it relates to hair, says your ferritin should be over a 70, okay? And then now we've got, again, the neurology saying for restless leg syndrome, your ferritin should be over a 100. And so I'm gonna tell you this right now, that your target ferritin, right, should be probably at least a 65. If you have these associated symptoms, and this is where it gets crazy. Again, enlarged periventricular spaces in brain, Bella, potentially because that's a marker of inflammation. So Naomi, right, if your ferritin, okay, is a 12, then you are definitely more likely to experience POTS. Now, part of that is because your ferritin level is low, but low ferritin is a red flag. So meaning if your ferritin is low, there's a reason why you have a low ferritin. And for most of you guys, it's not menstrual cycle. It could be. It could be heavy menstruation. That's the second most common reason for low ferritin. Alexis, typically it's gut health. Okay, Erica, ferritin is storage iron, so it's an iron protein, right? It's involved in iron physiology. Ferritin, when it's high, is inflammatory. It's an acute phase reactant, okay? Is multiple sclerosis serious? Is that a serious question? Like MS is a debilitating disease, okay? But when your ferritin is low, right, there's a reason, there's a mechanism as to why your ferritin is low. Erica, if you have underneath a 70 for ferritin, you're not getting blood flow to your scalp. Think about it. If dermatology, right, is basically saying at this point, tilt this just a little bit, right? If dermatology and dermatologists are basically saying, hey, if you want to regrow your hair, your ferritin should be north of 70. So again, yes, it's going to be a factor as to why you can't oxygenate. Again, this is not about, okay, then just take iron. Kirsten 134, how often should ferritin be checked? So again, so you have an inflammatory condition, right? Like I said right here, 89% of patients with a positive tilt table test have autoantibodies against G protein. That's your central nervous system tissue. Okay? Susie, the concern is if you just go to taking iron, a lot of people will experience constipation, nausea, right? They get gut symptoms. So what I'm going to tell you is that if you already know your ferritin is a problem, right? The mechanism of ferritin right here is also related to your POTS. Even liquid iron, Donna, because guess what? Well, I'll tell you Wednesday. I'll leave you. Donna, you got to sign up for this webinar on Wednesday, okay? You guys think I'm bringing this? You guys, I've been working with, again, dysautonomia for 18 years. Gloria, of course, because blood flow is a major factor in migraines. Thorn, I don't know how you access care like this in the UK. You guys don't have a lot of options. Let's go, Hope Gardner. Bravo. So again, right, Lori, vitamin C increases your absorption of iron. So again, let's start over. Okay, let's start over. My name is Dr. Ian, right? My practice is called Dr. Autoimmune. Okay. We're talking about POTS, postural orthostatic tachycardia syndrome, POTS, right? And POTS is defined, right, by a heart rate spike after a positional change. That is confirmed, right, by what's called a tilt table test. But here's the deal. The crazy thing is 68% of patients with tilt table testing, right, positive tilt table testing, they'll get a psychiatric diagnosis, again, 68% of the time prior to a POTS diagnosis. Okay. If you have POTS, your options are salt, water, beta blockers, and compression. Okay. So now what we need to talk about, right, and understand is that in 2019, Journal of American Heart Association said that, hey, 89% of patients with a positive tilt table test, right, that's a POTS test, had G protein autoantibodies, right? Essentially establishing an autoimmune connection. Kathy, compression would be like stockings, like compression leggings. Okay. Yeah, Thorn, again, beta blockers for some patients they're you do not tolerate them. Do you guys keep asking the same questions over and over again? You're going to get muted, by the way. Ask a question. We'll see if I get to it. So Alexis, beta blockers essentially, right, decrease the intensity of your heart and the heart rate. They lower heart rate, okay, and the intensity. So what happens is that you can't compensate to lower blood pressure. So for some people, it actually makes them worse. For some people, it helps with their anxiety because when you spike heart rate up because your blood pressure is low, right? What you're doing is you're compensating for that low blood pressure. So your body is trying to push heart rate up to get blood flow up here to your brain. Because again, you're not able to vasoconstrict blood vessels in your lower extremity. All right. So unfortunately, though, again, what can happen with a lot of beta blockers is people feel fatigued with them, or right, they don't see as much relief as they want. Any nerve compression issues, Sarah, can cause POTS. Amy, you can definitely put it in remission because again, 90% of the time it's autoimmune. Optimizing POTS with someone with so that's what I was just describing. So if you have hypovolemic POTS, some people are going to benefit from beta blockers, but some people actually feel worse, right? Caddy, no, not if it's not triggered by anything that's not warranted, right? So again, it's typically, again, not just a 30 beat per minute, but it's over a certain number. That's what, again, confirms the tilt table. So there you go. You're feeling worse. So again, please, optimizing POTS. It's in your name, right? Come to my webinar. So what I just mentioned, right? We just talked about autoimmune. Remember, guys, symptoms ebb and flow, up and down, right? So if you look over here, right, ferritin is going to be one of the markers that has to be tested when you're working patients up from a root cause perspective for POTS. And the reason is if you have low ferritin, right, you're going to have poor oxygenation. You're not going to be able to move blood volume if you've got not just low hemoglobin. Guys, low hemoglobin confirms anemia. Ferritin drops before your hemoglobin. So your lab low for ferritin, okay, is a 15 in a female. It's a 24 in a man, all right? But I'm telling you right now, right, Neurology says your ferritin should be above a 100 if you have restless leg syndrome. The dermatologist said if you want normal hair growth, you got to be above a 70. The gastro doctors out there, the American Gastroenterology Association, says your ferritin should be above a 45. So again, I need you to understand that POTS is a syndrome. That means there are multiple mechanisms to it. Caddy, yes, that is my belief. It's not going to be every case, but I think it's the vast majority of cases. I think it's 90% of confirmed positive tilt table testing is going to be autoimmune. Good. So again, I wanted to come on here. Couple things. I'll mention this. I'll mention a couple things, guys. Again, I've been practicing functional medicine for 18 years, right? And I had seen quite a few dysautonomia patients prior to 2020. Now, my practice exploded with dysautonomia patients after kind of and during the COVID era. So ferritin is one, right? Another major mechanism, right? Two is going to be infectious. Again, especially spike protein. Okay. So we will certainly talk a lot more about that, right, during the webinar. But it's just it's something that's important because, like I said, just like you should have ferritin tested, you need to have your spike protein levels tested through LabCorp as well. Okay. Aura, yes. We only work with patients in the United States. Okay. Rose, again, infectious issues, drive, AS. Cole, that's one of the things that happens. Yes. So when you get a spike protein infection, that's either from the vaccine or from the actual organism itself. For, again, people that were susceptible, they were kind of on the tipping point. They then actually either reactivated Epstein-Barr, they typically reactivate Epstein-Barr virus. So then now we have Epstein-Barr virus, right, that has come back. It has come out of your central nervous system. It has reared its ugly head. It has spiked inflammation, suppressed your immune system, and that induced autoimmunity. So that actually, again, caused these, what's called G protein autoantibodies. Remember, these are not tested by this will not be tested by your cardiologist. This will not be tested by your neurologist. And it's certainly not going to get tested by your primary care. They don't even know what G protein antibodies are. Okay. So Syra, I would recommend figuring out why you have low ferritin. Okay. So you don't take ferritin as a supplement, right? You need to understand, right, that there's probably mechanisms of impaired absorption. There could be menstrual issues, irregularities, right? Like you're losing blood flow, but you're losing more than you should. So there's going to be there's different things that influence your ferritin. So what happens, right, is when people find that they have low ferritin, they usually take iron pills, and then they realize they don't like iron pills. Can anyone relate to that? That they get gas, they get bloating, they get cramping, they get constipation, nausea, that kind of stuff. Bobby Cam, yes, I have seen the vaccine induce autoimmunity. Okay, so, okay, this is gonna be the last thing that I talk about. So, because there's a lot of people dealing with that right now, all right? So listen to me. Let's find a little bit of room to talk about that. Okay, so we've got this scenario, right, where we've got like suboptimal ferritin. And again, there's anxiety and attention and focus issues, right? There's lots of stuff that comes with it. You walk upstairs and you get lightheaded, right? Yes, heart rate spikes are very typical, characteristic, poor quality hair. Remember, POTS is always in relation to other conditions too. So guys, when you have POTS, a lot of times you already have another diagnosis, okay? When you get POTS, guess what? In the next 5 years, dramatically high rate, right, of additional inflammatory diagnoses. Okay, Sarah, insurance doesn't cover functional medicine. Okay, so again, but Sarah, we do our best to make what we do affordable for patients, right? We have to go in, we got to use labs, we got to figure out what's going on, we got to work you through your root causes. Okay, so we're talking about how do we raise ferritin, right? So again, one of the most consistent mechanisms behind low ferritin, right? Or let's just put it like this: if, right, you are taking oral iron, right, and you increase IBS symptoms, okay, the next concern is that, again, the mechanism, right, of that oral iron is that you just increased methane. Where does methane come from? Methane comes from bacterial overgrowth. Okay, in your small intestine. So where's your immune system? Rebecca, I agree with you. Been practicing functional medicine for 18 years. I have seen the most amazing, life-changing transformations in my patients. If I had to go back and choose another career, I would do exactly what I'm doing right now. It has been it's like the best decision of my life. Holly, thank you, right? In your gut. Syra, no, I do not advocate molasses whatsoever. It's non-heme iron. Heme iron is absorbable. Non-heme iron is 30% at least less absorbable. Olivia, we're in Colorado. Okay, did you hear what I just said there? Okay, so if you're seeing low ferritin, for me, anything under a 65, okay, for POTS is going to be low ferritin. J-Law, what's up? Right on, man. I was born in Fort Collins. So again, with low ferritin, okay, if oral iron, right, you can't really see that, but if it triggers IBS-like symptoms, right, so if you see a spike in constipation, gas, bloating, nausea, iron feeds bacteria that produce methane. Oh, snap. Your gut is driving the autoimmune response that is causing your POTS. You can take all the salt you want. You can consume all the water you want. You can take beta blockers and you can put on compression stockings. Okay? So Veronica, right? If you look, Veronica, we've got a webinar. So we got a webinar on Wednesday, but we also have, we just introduced this week, okay, a $40 15-minute consult with myself. So if you go on my link tree in my bio and you want to book a consult and you want to talk about what's going on, okay, then I'm going to give you my best recommendation. It might be, hey, come work with us, we can help you. It might be, we can't help you, go this way. But over 18 years, tons of dysautonomia cases that I've worked with, we've gotten pretty good at resolving most cases. We absolutely improve function in the vast majority of our patients. We find other additional issues. It's always about correct the upstream most important and relevant inflammatory triggers, because what's going on down here, this is the manifestation, the symptoms down here. Again, dysfunction, change of physiology, symptoms, right? I don't want to chase your symptoms. That's what other doctors do. I want to go after this. I want to go after the highest root cause. So if you guys, again, I'm going to encourage you, come to the webinar. Registration is in my link tree in my bio. If you guys are ready and you want a phone call with me, 15 minutes is $40. Sandra, appreciate you. That's what we want. We want to be a blessing, right? So you guys can go to my link tree. You guys can go to my bio. And you guys can see what we do, right? We have a website. We've been around for 18 years. Again, the whole point of this is that we change people's lives. And I don't say that lightly. It's not a claim that I'm going to make lightly. And you also have to play your part. You have to be ready to change your diet. You have to be ready to give certain things up, right? I look at all your paper. So for the evaluation, right, you have a phone call with staff, and then we get blood work, right? And then I go through your whole case. I go through your paperwork. I go through your labs, and then I actually will customize recommendations based on that, okay? So guys, again, my name is Dr. Ian. My practice is called Dr. Autoimmune. Appreciate you guys hanging out with me. I'll be back on Monday. So Monday we'll be talking more about this and other subjects. So guys, again, if you want to follow me, great. You'll see more of my content. I do have quite a few videos up there on POTS already. If you guys want to do some more research on my profile, like I said, we got a webinar again on next Wednesday, August 19th at 5 o'clock Mountain Standard Time. Okay. So again, until next time, and as always, let your health soar. Cheers, guys. Be good.